Hello, everyone, and welcome back to TMI Talk with Dr. Mary. I'm your host, Dr. Mary. In this episode, we're going to be talking about gut health, ongoing pain, the nervous system, subconscious beliefs, and how spirituality can help support our nervous system. I'll dive more into the specifics on the episode, but before I do that, we're going to introduce our guest. Our guest is Dr. Megan Steele. She's an accomplished physical therapist, educator, and researcher specializing in chronic somato-visceral pain. She received her doctorate of physical therapy from Mount St. Mary's University, where she currently serves as part-time faculty, teaching orthopedic pathology and pain science to doctoral students. She is currently pursuing a PhD at Azusa Pacific University, focusing on how the somato-visceral systems influence pain chronically, with a particular interest in the cognitive and subconscious mechanisms of underlying pain. Before becoming a physical therapist, Dr. Steele earned a master's in exercise physiology and worked in inpatient cardiac rehab. Her comprehensive approach to care integrates a functional manual therapy from the Institute of Physical Art, IPA, and visceral manipulation from the Barral Institute. She is also a passionate advocate for pre- and postnatal care, pelvic health, and incontinence training, often incorporating cognitive physical therapy to support holistic patient outcomes. I'm just so excited to share this with you. I know I probably say that about every episode, but I think you'll find this episode fascinating based on her research and looking at the brain and the body in so many different ways. So we're going to dive into how ongoing stress and nervous system dysregulation can impact pain, gut health, and our relationships. We start by understanding our body on a subconscious level. So things that we're just not even aware of with our cognitive brain. So just me talking right now is using my conscious brain. So when we start understanding this from a subconscious level, it can shift our entire perspective on our health and understanding what's happening, not just what we think is happening. We explore how to gather data points on your own health so you can find the right practitioners, because let's be real, not all of them are created equal, and we don't have enough time in our healthcare system for our healthcare practitioner to put all the pieces together for us. We also discuss the impact of trauma, especially sexual trauma, on how we perceive stress and why certain environments, we might not even be realizing how much these affect us. And for those who love to travel, we also discuss how traveling impacts our gut health, because you know how it's like to be constipated or having diarrhea when you're on a plane, and we know that's not fun. And here's also something that's often overlooked is how our spiritual beliefs can affect the nervous system, even when we don't have a strong support system or feel stuck in jobs or relationships where we really feel that we can't leave and we need that extra support. And it is really hard to summarize all this because there are some fascinating tips on how to stop this dysregulation and to stop associating pain and fear with a certain activity or a certain environment, and understanding how to really kind of hack the brain from a scientific level to help stop that negative loop. Overall, I really hope you enjoy this conversation because, again, it was another fascinating conversation, and I'm really excited to share it with you all.
Ready to tackle the topics that you've been curious about but never felt comfortable asking? With a straightforward, no-nonsense perspective on life, blended with candid stories and a healthy dose of humor, Dr. Mary Grimberg cuts through the fluff and addresses the conversations we all need to have on TMI Talk, where no subject is too taboo. Our bodies, our minds, and everything in between. Now here's your host, Dr. Mary.
Welcome, Dr. Meg, to the show. Thanks for coming on.
Thank you so much for having me. I'm excited to be here.
Yeah, we're going to talk all things gut health, poop, pain science, and how it affects the brain. So we'll just go ahead and jump right in.
Love it.
Yeah. So can you explain how gut health is indicative of overall health, including its impact on health, on mental health, in your opinion, based on your research and experience?
Sure. Well, first, I think maybe it would be helpful to know a little bit more about me. I'm a physical therapist by license, and I came to gut health via osteopathic medicine. So I practiced as a physical therapist for a few years and realized, not having 100% success rate, maybe there's something I'm missing. I did the thing that we all do as physical therapists, which is to protect my ego in certain cases and put the onus on the patient and say, that's probably because you're not doing your exercises. Couldn't be that I don't know exactly what's going on. So I owe some people an apology, like most of us do, right? But I went back and I said, well, maybe there is something I'm missing. So 2 years after I graduated, I started looking into osteopathic visceral manipulation coursework. And I pursued that for a few years. And I took all the classes. And it really broadened my understanding of pain, the physical body. As physical therapists, we tend to be really biased towards the musculoskeletal system because that's our wheelhouse. That's what we know. That's what we studied for so many years. When really the musculoskeletal system and the skeletal system are 2 of the 11 systems in the body. And so we tend to ascribe all things to the musculoskeletal system, all things pain really to the musculoskeletal system, when really there are many other systems going on in the body. And one of the most important systems is our digestive system for so many reasons, but I'll give you kind of my top 3, I guess. We could be here all night. But so I guess my top one is it gives you so much great data. As a pain science researcher, I love data. It's probably not as fun to be married to someone like me because my husband will suggest that, maybe we give our daughter Tylenol. And I'm like, we don't have enough data points for that yet. And he's like, okay, you need to reel it in. But so after I took all this osteopathic coursework, I was finding success in my practice. But I guess there are still parts of physical therapy that tend to be very musculoskeletally biased, and they're not necessarily on board with any of this. And the research on the visceral system is not great. It's heavily biased, and methodologies aren't great. So there are a lot of issues with it. So then I said, well, I'll go get a PhD and prove some of what I'm seeing to be true in my clinical practice. Because you can't really say, well, it works for me, so it should be working for everyone. So long story long, I think the gut gives you so many good data points about what's going on in your body, how healthy you are in that moment. Skin, hair, and nails give you a lot of good information about what's gone on in the last weeks and months. But your gut can tell you, specifically your bowel movements, tell you about what's gone on in the last few hours, 12 to 24 hours, depending on who you are. If you're someone that goes 3 times a day or 3 times a week, both are within the range of normal, you're getting a lot of good data about what's going on in your body. And you're getting a lot of good data about not just your somato-visceral system, not just your GI system, but also your nervous system. Because your gut and your nervous system are so closely tied together, most of us by now have heard of the gut-brain axis and the vagus nerve. It's been a very popular topic of discussion on a lot of TikTok reels. And sometimes they get it right, and sometimes they've oversimplified it to a state that it's not as helpful for people. So we know the vagus nerve connects our brain and our gut. We know that about 80 to 90% of the nerve fibers go from the gut to the brain. And as a physical therapist who works with people primarily in chronic pain, I find that because I'm not a quote unquote mental health professional, it's sometimes hard for people to get on board and to understand that we actually talk to people about their thoughts and feelings and how their thoughts and feelings connect to their pain. And one way to do that is a bottom-up approach. So talking about how your physical body affects your mood, and your gut does that through the gut-brain connection of the vagus nerve. It does it through your immune system. It does it through your microbiome. And so there are many, many ways that our bodies are physiologically affecting and impacting our brains and how we're functioning from a mental health perspective.
I love that. I love how you are initially saying, when somebody's not getting better, it's like, okay, they're not doing your exercises. And yes, I do agree that the patients still have to take accountability, but at some point when they're dealing with chronic pain, they've been gaslit enough that they're just like, well, everybody else has kind of given up on me, and they're trying because there's not this secondary gain. It's not like anybody's excited to be in chronic pain. And when you can get somebody that can explain it like what you're saying, it can make a big difference. And it has been really frustrating for our profession to just be like, just focus on musculoskeletal. And when you focus on and divert from that, even looking at the fascial system and lymphatic system, it's like, that's shit on sometimes too. And I'm like, cannot
Right.
ignore these things. And I've seen even like acupuncturists look at the full body, and like chiropractors do as well. And physical therapists were like, no, it's just this. And big disservice. It's a big disservice. And yeah, like gut health and the brain health and understanding that whole interaction. I mean, how many people have you seen that are diagnosed with IBS and they're put on these insane diets that are unreasonable when there's stuff, research coming out about, it's more of the nerves. It's the nerves connected to the brain and like you said, the vagus nerve and how they all interact. I think what's hard though is when somebody's dealing with chronic pain, right? You're like, okay, well, our thoughts and feelings affect our physical body, which affect our gut. And then what happens though is that typically if we're trying to calm our nervous system, a lot of people do that through exercise, but you can't do that through exercise if you're in pain. So then you develop this kind of negative loop. And what would you say to somebody who's maybe in that loop? Because it's, I have different things that I've said, but I'd love to hear your point of view on how to help somebody with that.
Sure, absolutely. And I think to your point about, protecting our egos as practitioners and people in pain, especially for people who've been in pain for long periods of time. I used to think that, if somebody didn't get better, if they didn't get across that finish line with me, then that was a failure. And what I've since shifted to, which has helped me, and I think the people that I serve, is if I can't figure out why you're in pain, I'm not going to tell you that your pain is not real. I'm going to tell you that I'm not the practitioner for you. And so rather than saying, well, if I can't recreate this pain, if I can't improve this pain, if I can't change this pain, that tells me that this is outside of my scope for whatever reason. Maybe this is more on the mental emotional side. Maybe this is more on the social side, whatever it is. And I think that if we adopted that as practitioners, we'd be so much less likely to shift blame and place blame, because if then I'm not the only person with any answers, then you can have an impact on how you need to get there, kind of having that accountability piece to that person of saying, I recognize this is real. I recognize all pain is real and should be taken seriously, but maybe I'm not the one that's going to be able to figure this out because I don't have a skill set, or I don't have an understanding of where this pain is coming from. To your point about exercise, I hear this all the time is especially with physical therapists kind of getting away from the manual therapy of like, I was told if I just did my exercises, and there is a great deal of research that shows us that exercise reduces pain. And that's in part because of an endogenous opioid system in our bodies. And so we know that exercise is great. I had a patient tell me one time, they're not going to come up with another reason why exercise is great that's going to convince me to do it. Like, there are enough reasons. We get it. Exercise is fantastic. We should all be doing it. We should all be doing it regularly. What I tell people is, I'm not going to ask you to start rebuilding a house when the foundation of the old house is still on fire. That doesn't make sense to me. It's going to be seen as a threat to your nervous system, and it's very unlikely that you will make progress when you're in pain from an exercise standpoint. Exercise can sometimes help people get out of pain, but more often than not, we need you to be out of pain before you can start the exercise, or at a reasonable level of pain that you can tolerate movement through.
Yeah, it's like the kind of more graded exercise. Because when you're dealing with chronic pain, most people are never out of pain. And so there's balance between, okay, what can we do to kind of get you moving? And in that, and then when you start when you can start moving, even just like smaller movements, I've even seen it where people will just be like, okay, if you're in chronic pain and you can't go and exercise, just kind of from a somatic standpoint, needing to release those emotions from your body too. And I've even heard it where people just, if you can't exercise, you can't do those things like tensing your full body and then releasing, tensing your full body and releasing. So you're still kind of getting some muscle activation.
Yeah.
That.
And there is some evidence to suggest that that helps with pain. Absolutely. If somebody can't move at all without pain, you can start by visualizing. You can start by watching someone else move. That actually activates areas of your brain that connect to your own body's movement. Those are places to start. They do that with like CRPS. They have people, understand different hands and, feet. And so that you can start to lateralize and recognize right from left and things like that. There's a fair amount of research too coming out about interoception and things like a yoga nidra meditation, where you would go in with your mind's eye and visualize those areas of your body. Because it's kind of interesting. You think about with people with chronic pain, they have such an awareness of that area. Sometimes that's true, and sometimes it's the opposite. Like if you ask someone in chronic pain to draw a self-portrait, oftentimes they will omit the area that is very painful for them. And Frida Kahlo was a great example of this. You very rarely will see her back and her legs in her drawings and her paintings. And I have someone who's an artist that came and spoke to my chronic pain class of physical therapy students, and she brought in some of her paintings. And when she was having a great deal of arm pain, she drew herself with something obstructing that area. And when she was having radiating leg pain, she would only draw herself from the waist up. And so actually going in and recognizing those areas or observing them in a non-judgmental way with your mind's eye can help to decrease some of those pain signals.
That's incredible because, for people that don't know Frida Kahlo's story, her pelvis was crushed in a bus accident, right? It was an
Spine
accident.
and pelvis. Yeah, she had tremendous amounts of pain throughout her entire adult life.
Yeah, and she became infertile, I think, because of the accident, and she suffered so greatly in so many different ways. There are some documentaries on her. I actually went in Mexico City to visit her home this summer.
Wow.
It was incredible. You could see her wheelchair, you saw her bed. I was very happy to see at the end of her life that she was starting to get recognition, but I don't think she got to the degree that she is now with her. But I knew from the neurological standpoint that when somebody's dealing with CRPS, so CRPS is chronic regional pain syndrome for people that don't know what that is. The other thing you were also mentioning too was how our body kind of has our own, you said the
Endogenous opioid system.
So basically what that means is our own pain relieving system. So I'm just explaining it for people that are listening that may not be in healthcare, what that means. So somebody has chronic regional pain syndrome, they have a specific part of their body that is just incredibly painful and extremely sensitive to touch. And you can probably dive into this a little bit more on what that looks like. But I know that they've done a lot of mirror movements. So basically you only see the unaffected. So say if the left arm's affected, you only see the right arm, and then you put a mirror to block the view of the left arm, and then you can move that right arm. So you trick the brain into thinking that it's the left arm. Is that the same mechanism that you're seeing with watching other people exercise?
Yep, absolutely. It's working on those mirror neurons, and especially when you're doing it in a calm nervous system state. And so if the thought of moving my own body is so terrifying to me, my nervous system is going to be on high alert, right? It's going to be sounding the alarm even before I move. And that's in part because our nervous system learns through associative learning. And they estimate that like somewhere upwards of 80% of our learning happens associatively. And that's so true with our nervous system that I learn over time movements like this equal pain. I start to reduce the amount of movement I do until I don't move at all. And to your point of then to watch somebody on Instagram or to watch somebody on Google to just say, just get exercising, 5 tips to fix your back pain or 3 stretches and you'll never have pain again. And then I try that and then I fail again. That, I'm less likely to think, well, this doesn't necessarily apply to me, as opposed to something is wrong with me. I'm the problem. And then that leads to my further feelings of, well, maybe I never will really get better.
Yeah, and nobody understands me, and maybe it is my fault. Maybe there's something, I've even seen it where some of these spiritual gurus will be like, just meditate it away. And it's like, oh my
Mhm.
God, like you can't, it's really hard because I get meditation can be helpful, but
Mhm.
there's also this component where maybe some people uh, we're humans, and sometimes that can
Yeah.
be so detached from the reality of our physical bodies as
Yeah,
well.
absolutely. And I think a lot of the psychological world is getting into pain recently as well. And there have been studies about things like explain pain and those types of things. And then, there's John Sarno, who's been around for a long time, and the mind-body connection and things like that, which I completely agree with. But even if you narrow it down to, pain is in your brain, you're still taking this hugely complex thing and saying, I'm going to sort of talk you out of pain. And for some people that works. Some people, absolutely, that will work for them. But as pain goes on longer and longer, it goes in deeper, deeper parts of your brain, the less conscious, the more reflexive, more protective parts of your brain, as opposed to the outer parts of your brain that are more under our conscious awareness and conscious control. And this is where talk therapy happens, is in my cognitive thinking brain. And in my deeper, more reflexive brain, I can get there 2 ways that I know of: hypnosis or through touch. And that's where I think we as physical therapists have a tremendous advantage, because we have a license to touch people where in the psychological community, they do not.
Yeah, there's a big gap, I believe, between so especially when I'm working with people that have history of sexual abuse, they'll work in psychotherapy to help the process or move through or develop strategies to heal after, such a traumatic experience or multiple experiences. And
Mhm.
then from a physical therapy standpoint, if they're dealing with chronic pelvic pain or maybe fear around sex again, because that relates to this specific event or multiple events, you start associating the two.
Yeah.
And I find there's a big gap because, okay, well, I'm not a psychotherapist, but then a psychotherapist is not a physical therapist. And so I find that it kind of falls more on the PT to help bridge that gap. And that's something that I found in our practice is that we tend to be that bridge. Cause yeah, what you were
Mm.
describing for people to understand is like the conscious brain and then the subconscious brain. Right.
Mhm.
And
Mhm.
so you were trying to tap into the subconscious brain. Is that what you're saying?
Yeah, absolutely. And that's what I'm really focused on with my manual therapy. And that's why I tend to use things that are more lighter touched, and they're more focused on the autonomic nervous system, like the visceral techniques, because that's really where I feel that I've been able to move the needle with people, especially when they've gone through the musculoskeletal treatments and have not had success, because that gets into your more deeper, more reflexive, less conscious areas of your brain.
I find that there's this struggle between, like, when we talk about the nervous system, right?
Mhm.
Pain started somewhere. There was an actual, in my experience, there was an actual injury or dysfunction or something that started it. And then the nervous system's like the fire on top of it. right? So I think of it like almost like gasoline to this like maybe little fire. Also seen it though on the other end where people are like, you're just stressed, like just de-stress. But there's also an underlying issue that has been misdiagnosed for long enough that now it's become chronic. So how do you describe it to your clients when maybe they do have an underlying, like say, you know, maybe they've had misdiagnosed lumbar referral, right? And they're like, oh, you know, my hip's clear, everything's good, but it's actually a referral from the lumbar spine. And now at this point, then they have stopped exercising, then they've developed chronic hip pain, and now they're depressed, and now they're in pain. And how do you describe that to that person? Because there's a fine line, because they've already been gaslit just by saying, hey, it's just anxiety. That I feel like there's this fine line between, hey, this is anxiety or the nervous system is hypersensitive right now, but also what can they do with that? Because then if they can't get out of it, then it's even more in that shame cycle.
Yeah, that's a great question. I like to explain it as layers of an onion. And typically when I'm working with someone, if they've got a very protective nervous system, a hyperactive or hyperprotective nervous system, however you want to describe it, that is the layer that has to come off first, because that's your body's primary protective mechanism is your nervous system. And pain is one of the primary ways that your nervous system protects you. Pain is necessary, as you know, and it's our body's way of saying, I need something different. I need you to do something different. I need you to act differently. I need you to move. I need you to quit sitting on your foot, whatever it is. And so I explain that to them as, yes, there's probably from a musculoskeletal standpoint something going on, but because of your nervous system, we don't know how much is being contributed from that and how much is being contributed from this. And the other piece of it is that your nervous system has a set point, and that set point has been decided long ago, and it's been adjusted throughout your life. So, you know, to your point about trauma, people who have experienced childhood trauma, their nervous system, while it was growing and developing, learned a certain set point. And those set points are a little harder to change than set points that were learned later on, because that's part of how I've known myself as I've grown and developed. But it doesn't mean it's not changeable. So your nervous system is really kind of the CEO of your body, essentially. It's the boss. It's the one that we're going to be constantly checking in with and saying, you okay with these changes, boss? I wanted to run this by you before I change anything here. And, you know, I work on the nervous system almost always at the beginning and at the end of every session, because if your nervous system is in a state of high alert, there's not a whole lot I can do that's going to stick with you. There are some changes that I can make that could be very short term, but ultimately I'm not going to be able to really move that needle with you until your nervous system is in a state that feels safe enough for me to touch you and feels safe enough to make changes. And so I'm always kind of talking about the nervous system in that way, as opposed to kind of this separate entity that, you know, yes, your nerves transmit signal, but we're not going to worry about that kind of a thing.
Yeah, that makes sense. I think that incorporating it all is super important. And, you know, in our day and age and everything that's going on, there's a lot of stress outside. So say on top of childhood trauma, and that's something I have had to work through and understand my nervous system. So like you were saying, it is possible, but it has been a lot of work on my end to like reprogram a lot of these beliefs. I mean, I was living in deep shame every day. And so like anything that like these little taglines that you're telling yourself every day that maybe you don't even realize you're telling yourself, right? You're not, right? Like you can't do that. These limiting beliefs are just so encapsulating that you can feel paralyzed.
Right. And those are so deeply ingrained, like you say, that they're part of your subconscious awareness. You know, they're subconscious until they are conscious. And I think part of the healing there, as you probably found in your talk therapy is that, they have to be brought to the conscious awareness to be worked on. And that's the same with the physical body as well.
Yeah, I find that just with bringing them to your conscious awareness, like for the longest time, I was like, oh, trauma is for people that had these experiences. Maybe then went to war, and then everything else is no. And so I had no idea really until developed cancer years ago that I was like, oh my God, because I say this a lot, but I was doing all the things that were like we say are healthy with diet and exercise, but none of that stuff to me can stick. Kind of what you're saying is if we're not getting to this root, but so many people, it's so hard to tap into your subconscious when we're being inundated with social media. We're getting inundated with stress from work, stress at home. Like it's just, for some people, it's just so much all at once. And so I find that, at least in my practice, getting people to start noticing what those thoughts are. And we've even incorporated vibroacoustic therapy into our practice. So they'll lay down on a bed and it really helps them. And it uses different frequencies to kind of tap into the brain and different parts of the brain to help tap into their subconscious. And the reason we got that bed is because I was like, this is really hard to get people to understand what their subconscious is, because
Yeah.
so much in our brain and less in our body.
Yeah.
And so without a bed, right? And what do you tell somebody? Like, what are your tricks to kind of get somebody to, or tips on how to get somebody to even recognize that they're subconsciously in this state?
Yeah. And I can't tell you how many times I've had people come in, and I have it on my intake form too. Tell me about your stress level. Tell me about your, stress at work, at home, those types of things. And I can't tell you how many people go like, yeah, I don't really, regular stress, the norms. Oh,
Yeah.
yeah. Oh, okay. How often do you have a bowel movement? Once every 5 days, or like 3 explosive diarrheas in the morning. And then if I have a stressful meeting, then I'll have to rush to the bathroom immediately. And so you can start to I think the gut is a great window of opportunity into that, helping people understand, like you can gaslight yourself from the neck up as long as you want, but your body is going to say, no dice. We're done here. I'm not playing this game with you anymore. And that's usually when people seek help, is when their body starts to rebel or break down or betray them are some of the words I hear. And oftentimes like my first cue in those situations is like, no, we have to reestablish this friendship and this relationship, because this is the only person maybe in your life at this point that's telling you the truth. And this has to be listened to. And so oftentimes I'll have people talk about or think about XYZ stressor in life. Tell me about what's going on with your kids, if that's the thing that comes up in their subjective exam. And my subjective exams are like, from a teaching standpoint, like if I were to teach it in my orthopath class, like I'm sure the captain would say, this is an unapproved, I'm like, tell me about what's going on, and they're like, what do you mean? Like, it's whatever, you learn a lot with the open-ended kind of questioning of like, what's on your mind? So if somebody's telling me about their injury, but then also I have to drive my kid 45 minutes each way to school every day, and they sit with their AirPods on in the car and they don't want to talk to me, and then my hip starts pulsating. And I'll say, okay, let's think about that drive. Let's just think about driving that drive and tell me what you feel in your body. And then, all right, okay, well, let's, if that doesn't really give you any kind of a signal, what do you think about, just think about your daughter. Tell me what you notice in your body. And then that's when my hip starts talking to me again. And so helping people kind of see those connections, I think, is really my goal as a physical therapist, when it's less about the physical system, when somebody's been in chronic pain for some time, or, which is harder. I've had people that have had, been in really tough relationships. I'm thinking of someone that I saw recently that had UTI symptoms. And it started after a particular weekend with a particular partner, and they had been intimate many times. And, over the course of working together, we worked on pelvic floor, we worked on some of the visceral structures, and we made some progress. But it wasn't until she said, I need to end this relationship, and she did, that her symptoms resolved.
I see that. Oh my
And
God.
right, from a physiological standpoint, there is not an explanation for that, right? But from a nervous system standpoint, there's the perfect explanation, which is once that person is out of your life, your nervous system got the signal of safety. And then it didn't have to send those danger signals anymore.
Yeah, it's starting to get people to recognize the connections. Like I have people that they know their job is stressing them out. They know that that is a major source of their pain. But in that, then they're like, well, what do I do? I don't know. I don't feel like I have enough data to be able to quit, right? It's not like that. It hasn't gotten to that point. And it's so much of these unexplained symptoms too. I've seen where people are like, I don't know, all of a sudden I just had these symptoms. I didn't do anything. And so they're thinking of it from the physical standpoint. And I'm like, okay, well, what emotionally happened during that time? Is there anything there? And I do find that unfortunately we have a lot of dynamics where there are at least I've seen a lot more in heterosexual couples where the male partner's just kind of completely blocked off and maybe potentially abusive in some capacity, maybe verbally, or then they're confused and they're like, I don't understand. Everything's fine, but it's only in these instances I feel uncomfortable with them, or this only happened once. And you find yourself making excuses for the partner and almost withdrawing and holding it in. And if you're listening to this and you're like, hey, maybe that sounds like me, just start noticing those connections. What does your body feel like after, maybe there's some miscommunication or an argument or something like that? When I find people start connecting the two, that's when, because it's not my job to tell somebody to break up, right? I don't know like it could be a miscommunication, right? Like, I don't know what's happening behind closed doors. I know what it's like to be in a relationship where the other person's cut off and feeling chronically sick and trying everything I can and pulling back, looking at it. I'm like, oh, it's crystal clear to me what it is now. But when you're in it, sometimes you don't know which way is up.
Yeah, absolutely. And I talk to people a lot about the antidote for chronic pain is social support. And so when you think about the opposite side of that coin, I talk a lot about the mechanism behind why social support works. And it basically works by allowing your nervous system to be in a calm state where it feels safe, essentially. And so the opposite of that is not safety. And then your nervous system is sending signals that I need some attention. Something is not right here. And sometimes those signals are nausea. Sometimes those signals are pain. Sometimes those signals are the pit in the bottom of the stomach. They present differently for everyone. And the associations are different for everyone too. And that's what makes it challenging. But I think those of us that work in chronic pain, that enjoy chronic pain, like we love a good mystery novel, or we love I was a Law and Order gal for many years. You just want to dig and get to the bottom of it and help them find out what are the connections here and what are the triggers that are telling your body to protect.
Yeah. Yeah. It's so much more than just the physical and listening to that gut feeling, I'd say, and I did a podcast episode on a few months ago on what the difference between your intuition. I know like you're a researcher, so you can't really like study intuition. But in that, it's that little silent, it's like a quiet, it's not a fear, it's not a scarcity, that's anxiety, but it's like this little kind of nudge. And then over time, it kind of gets louder and louder. And then if we're not listening, that's when the physical kind of symptoms start creeping in from that standpoint.
Yeah, absolutely. And you can't really study intuition, but you and you can't really study the nervous system. So we have like proxies for that, you know? So like heart rate variability is a proxy for studying the nervous system, essentially. And I think of interoception as a proxy for intuition. Interoception is how well do I recognize what's going on internally in my body? And so, and for many of us that live in Western society, you know, we are rewarded for ignoring those signals, right? We say, I can work for 18 hours straight. I only need 4 hours of sleep. I forgot to eat lunch because I'm such a go getter. And, or, you know, you look at your athletic populations, I press down and I suppress signals coming from my body about pain. So there's a high correlation between people who have low interoceptive awareness and chronic pain and eating disorders and anxiety and depression. Because when we're not listening to our bodies and we're not addressing those signals, the cascade, like you say, of negative effects is tremendous.
Well, it is. It's tremendous. And it's not something that is often talked about. And with that, you know, we were talking about like social support. Okay, so say if you're living with somebody that maybe you don't feel supported, but the likelihood is that there may be other people in your life too. And I've seen people feel really isolated. And so when you're isolated and in pain, it's hard to want to go out and it's hard to want to interact in community. And I like to talk about too, like beliefs outside of ourselves, right? And that's not something that, you know, I'm not sure how this looks in research, but have you found if somebody kind of has some sort of spiritual belief or something outside of them, that how that affects their nervous system? Because this is never talked about. And so I just wanted to kind of see what your thoughts were with that.
Yeah, there was a really big, really interesting study. Gosh, I want to say 10 years ago, somewhere around there. It was a while ago, but they looked at all the different factors that can work for chronic pain. They looked at medication, they looked at exercise, they looked at mindset, they looked at, you know, the list was tremendous. The two things that came out of that were prayer and cannabis. Not great for the psychological community, not great for the pharmaceutical community. But prayer and cannabis were the two things. And they looked at some of the reasons why. And, you know, when you say the rosary, one thing about the rosary is that the way that you breathe when you're doing it is it tends to slow down your breathing and your exhale is longer than your inhale.
Oh my gosh, I had no idea. So I don't know if anybody knows what the rosary is. It's a Catholic prayer, but wow, I never thought of it like that.
And there's a great book by James Nestor called Breath that he talks about breath work and things that we often in Western society teach our patients. We say, take slow, deep breaths, inhale through your nose, exhale through your mouth. Make sure your exhale is longer than your inhale. So then you're biasing that parasympathetic nervous system. There are so many prayers that follow this 6 breaths per minute pattern that we think in Western society, like, oh, aren't we smart? We just taught people how to slow down their breath and calm their nervous system. But that may be what people have been doing for centuries with prayer.
It's wild. Yeah, well, the other aspect that I've seen too, at least for my nervous system, is just trusting in a benevolent God or force or something outside of me that maybe I don't have access to a supportive community right this second, but I can trust that there's something greater that's holding me. And in that, regardless of what religious or spiritual beliefs you have, but if you have that as this benevolent, like loving force that always wants good for you, that can feel a lot different. But on the flip end, if you're constantly worrying and like you believe maybe in a God that's condemning or, you know, these different things,
Punishing.
opposite effect. So I find that, you know, I'll even bring that up in my practice. I'm like, hey, do you have a spiritual belief? And, you know, it's independent. I'm not pushing that on anybody, but just think about it, you know? And I never really, like, there was a point where I was like, you know, in a job that I didn't want to be in. And It was too scary to leave. And I just said, God, universe, who's ever out there, give me a sign. And I just kind of left it at that. And then it came so crystal clear months later that I was like, oh, this is it. Oh, the decision has been taken. It's just been made for me. And what a gift that was, is that I didn't have to, this pressing, crushing decision to be able to do that.
Yeah, absolutely. And that can be so calming and just beautiful for your nervous system and, so many aspects of it. I've used faith as an associatively learned calming technique with someone recently as well. She was in a similar situation. She could not leave her job. It wasn't financially viable for her family, but it was incredibly stressful, and her pain level would shoot up every time this boss came into the office, and it was like unannounced and there was no way to prepare for it. But when I asked her about when she felt the best, when she felt at peace and calm and the least amount of pain possible, she said at church. And she had this beautiful faith, and it like brought her community, and it brought her some of the things that you were talking about, like this recognition that there's something greater than me. And it was during COVID. And so I said, let's see if we can't do the associatively learning the opposite way. And so for a couple weeks, we had her put like lavender oil inside of her mask when she was at church. So then her brain started to associate lavender oil equals calm, loving, supportive environment. And then she started to, after 2 weeks of church, I said, let's try the lavender oil at work. Pain levels significantly reduced.
Oh my God, that's so cool.
So we can use associative learning to our advantage, right? I can teach my nervous system that this is a less threatening environment. And to your point of like, maybe it's not a completely non-threatening environment, but eventually she was able to get out of that job. And now she is surfing and running and all the things.
Yeah, that goes to, it's the Pavlov's law, right? With
Exactly.
yeah. And so that was, do you want to explain that for people so they can kind of understand? Because I think it is so important, especially when we're helping people like return to having sex, maybe after a traumatic experience, because now we associate sex with something traumatic. And can you explain a little bit about what that is? And maybe say if somebody is dealing with fear around sex again, how that can, a way that maybe the way that you're explaining can help them.
Yeah. So I like to give the example of like, taking it out of the sex situation just for, to decrease some of the maybe tension around it potentially. If I were rear-ended by a red car, every time I see a red car in the rearview mirror, my body is going to do, to a much lesser degree. This is a huge over exaggeration. But to your point about sex, the smells that person had, the sounds that were going on, the level of hormones that were coursing through my body, all of these things can become associated with that situation or that traumatic experience. And so which are the ones that are contributing to my nervous system going into that situation? Is it the position? Is it the smell of that person? Is it the state of my nervous system, the state of my hormone levels? What are those things that are triggering my body to go into that situation or into that protective posture or protective position? And how can I start to peel those away? And like we've spoken about earlier, bringing that up to my conscious awareness has to be the first step there. And so I need to know what those triggers are and what are the things that are making me or allowing my nervous system to protect, and how can I start to decrease some of that? And so one way, if it was a sexual experience and I felt that there was a smell that was connecting, and smell is really connected to our subconscious brain because it's like kind of right in that deep middle part, and we don't even need our conscious awareness to process smell. And that's why sometimes smell is so connected with memory. And so could I smell that smell in a graded exposure kind of a way where I say, okay, I'm going to smell it for a little bit, and then I'm going to go do something that makes me feel really good and really safe and really calm. And then I could try the next day a little bit more and a little bit more and a little bit more until I feel that or I smell that smell and I don't have that physiological reaction.
Can you explain what the Pavlov's? I always Pav.
Pavlov.
So
Pavlov's.
I think
Sorry.
that if they can understand that a little bit and understand the association, because it's very similar to what I'll say too, is just even if somebody is just non-sexual touch or even just visualizing it, getting your body to kind of, okay, I feel uncomfortable, and then go kind of calm your nervous system and then come back. That's similar to what I've helped people work through when having those associative reactions to sex or even anything
Yeah.
traumatic. And I love the idea of the smells and like even just going into like understanding the associated, like decreasing that association. But
Yeah.
explain the Pavlov's law.
Sure. So Pavlov was a researcher. He turned out to be not such a great guy for animal rights, but yeah, he was kind of a bad guy. But he established what's called associative learning or an associative learning model. So what he would do is he would ring a bell and then feed the dogs. Ring a bell and then feed the dogs. His research was on dogs, and what he found is then the dogs began to associate the bell with food. So they would start to salivate when they heard the bell because they associated bell equals I'm going to eat soon. And so that was how he proved associative learning, is that I rang the bell and there's no food around, but these dogs are salivating because they're anticipating food, because they've learned to associate bell with food. And so if I have learned to associate my job with pain or my sexual experience with pain, I can come out of that with extinction training, which is graded exposure is one way to do extinction training so that you decrease that association. So they often talk about Peter, little Peter, I forgot. Mary Jones was the researcher on that one, where she did extinction training. This little boy, Peter, was afraid of white rabbits initially. And I think maybe he had been bitten by a white rabbit or something. But then that fear began to expand. And then he got to be afraid of anything white or fluffy, even things like cotton balls that are pretty innocuous. So what they did for extinction training was they had Peter sit at the far corner of the room and they brought a white rabbit to the door of the room. Peter has a big reaction. He becomes afraid. They take the white rabbit away. Peter gets ice cream. Next week, they bring the white rabbit to a little bit further in. Peter gets afraid. They take the white rabbit away, ice cream, so on and so forth, each time getting the ice cream. And so when I teach pain science to the third-year physical therapy students, I say, this is very simple. Treating chronic pain is finding out what are the white rabbits and what are the ice cream. And that's how you get people out of chronic pain.
I love that because the brain is so, oh my gosh, it's so fascinating. And when you can start hacking it basically into these little details where you might not even be aware of these different things. I mean, I'm sure you all can think of smells. Like, it's funny, even to this day, I hate cigarettes, but like they remind me of my grandma who was so loving. And so when I smell cigarettes, I'm like, oh, I miss her.
Yes. And that memory comes like that, right?
Every time. And go like bacon and cigarettes.
She sounds like somebody I would want to hang out with. No.
Too, so you're just like,
give me more, give me more. I know. And we joke about, there are things that you can do as a physical therapist. Like I never wear red in the clinic because most of us associate red with danger, with inflammation, with stop, with pain. And then we joke about like we should pump in the smell of, freshly baked chocolate chip cookies, and that'll just bring everybody's nervous system, And when we have things like, models of the spine with these big red, nasty herniating discs, or the knee with the red arthritis around it. It's like, what are we doing here, guys? Come on.
Love that you're bringing this up because there is an aspect of clinic decor and the environment that is I've not seen anybody talk about it. And I was like, am I crazy? But I have it set where our clinic, we have no fluorescent lights. Like
Nice. Yeah.
and even in our new clinic, it looks like it's fluorescent, but it's LED, and then you can modify it and make it like a lighter kind of color. And then
Nice.
just about the environments, I am so attentive to it now. Like when you go into a hospital, it's stale, it's cold, there's no colors, it's just
Sterile. Yeah.
and fluorescent lights and loud noises. It is horrible for the nervous system.
Yeah.
Versus like I think I go, okay, if I'm a client and I go into a PT clinic, I'm looking at what colors are around, is there scents, what are the sounds that I hear, and I'm just so obsessed with looking at those things because, like you said, I'm not going to have like bright red in the clinic. I'm going to have like maybe like a light, like a green or like a warmness, like thinking about those colors and even thinking about your home, right? So maybe you're not a clinic owner, but your home, like how does your home make you feel? Do you go in and it's like, oh my God, there's all these different things that will have a direct effect on your nervous system too. And I tell people, because a lot of people like their gut will flare up when they're traveling.
Mm.
I'd love to kind of get your opinion on this too, but I tell people, I'm like, my experience when I've seen people with chronic pain and even my own self with somebody who's dealt with a lot of trauma is I'm hypersensitive to sounds
Mm.
and then like bright lights, but sounds and smells are like my two big ones. But which smells is hard to kind of block unless you're wearing maybe a mask, but
Mhm.
airports tend to flare people up. And I believe it's because every sense is being stimulated. Every sense, right?
Mm.
Your vision, you got the fluorescent lights, the sound, your flight, people running past you, bumping. So your sensation, so touch, vision, right? Vision, smell, sound, like all these things, and taste, that's kind of hard to block. I mean, because it's really
Sure.
mouth, but I'll tell people, I'm like, wear noise canceling headphones and a hat when you go to the airport and see how your body feels.
Mhm, mhm.
And even if I'll have people like, well, I have kids, I still have to listen to them. I'm like, well, there's those loops, those little like things that you can put in your ear so you can still hear people. What would you say to somebody that, I mean, constipation and bloating while traveling is just rampant. So
Huge.
I believe is directly related to the nervous system and changes in your gut and like what you're eating and things like that too. But what are your thoughts on that and what do you recommend?
Yeah, definitely. So there is, the if you're especially on a long flight, there's some dehydration that's going to happen. And so you can mitigate some of that with increasing your fluid intake, but none of us want to be in that little pill box of a bathroom on an airplane, right? And so people avoid drinking sometimes. But I talk to people about the fact that there are two sides of your nervous system. There's the fight or flight side and the rest and digest side. And when you are traveling, most of us spend a fair amount of time in fight or flight, especially if I'm going to make my flight on time. Is the security line going to go faster? Am I going to get flagged? Did I remember my passport? All the things, right? And so because I'm spending more time in this side of my nervous system, and of course it's a spectrum, it's never all one or the other, but I'm spending less time in my rest and digest side of my nervous system. So the blood is not being shunted to my organs to do the work of digestion because the blood is being shunted to my muscles to say, we might need to fight or run. And so what needs to happen on the other end of that flight or car ride or whatever is I have a moment or 10 or 15 or 20 or however many I need to help my nervous system come back down so that my body can do the work of digestion, so that my body can produce hormones normally, so that I can sleep tonight. All of those things that tend to get kind of shifted and off while we're traveling. And so I always tell people the good news is your nervous system is flexible. It's always moving, neuroplasticity, it's always changing. So there are times where we're going to be more in fight or flight, and that's okay. That's normal. Our bodies are meant to be able to do that. But then if you can build in some of those times in your schedule, I don't know if you're like my husband, who's like, well, we can see these 3 monuments on this day if we run from this one to this one. Like, then no. I am here to sit on the beach and do a lot of nothing. So we need to build that in. Yeah, and building those times into your travel, into your routine. Of course, it's more challenging when you have kids, but recognizing that if I'm going to travel, I'm probably going to be stopped up. And so how can I do the work on the other end of that to help my nervous system, help my digestive system to more normalize?
Yeah, I think it's important for people to know what's happening when you're in a fight or flight. And so peristalsis is the contraction of the gut to propel feces forward. And in that slows down when you're in that fight or flight. And like you were saying, that like the blood is diverted away and into our arms and legs because we think we're running from a bear or we've got to be safe. And so it's not being in fight or flight. I've heard somebody say this, and I really don't like this about the big healing kind of wave that's coming, is it's almost like we're supposed to be calm all the time. It makes me so frustrated to hear that, because that is literally impossible. And if you are, you're not exposed to the world that we live in. I don't, it's not, it's coming out of it. It's not staying in it.
Right. And that's a big key. And that's one of the ways they think maybe that exercise helps, is because your body learns that pathway up into fight or flight and then back down. And I often tell people, especially those of us that are disconnected from our bodies, if I'm having explosive diarrhea 3 times a morning, or if I haven't gone in 5 days, that's your body's way of telling you something is not right. Because when I'm in fight or flight, my body has 2 options. I either need to get rid of this food immediately so that I can run faster, or I need to shut this whole system down so that I can shunt the blood elsewhere. And so people feel really nauseous. They feel like I don't want to put food in the system, or they have those 2 reactions on the back end. And for lack of a better term,
I love talking about poop. I love when you're like explosive diarrhea, not just diarrhea. But like shit hits the fan, literally.
Literally.
Yeah, I think that, years ago, when I've been on this healing journey myself, is just noticing your gut health. Like, what does your poop look like? Are you having diarrhea? Even, I think people are unaware that constipation and diarrhea are also a spectrum. If you're still pooping, but they're little balls and you're straining and it's taking forever to go, that's constipation. And so something in your nervous system, or maybe even, something that you're eating, or your body's giving you a message, but we're not apt to listen because we don't know.
Yeah. And I think that's where asking like secondary questions really comes in handy. Sometimes we'll say like, if you're not really comfortable talking about bowel movements and things like that, well, how do you do digestively? Oh, fine. And then you move on and you go, is it a sausage? Is it a sausage with cracks in it? Is it the color of cardboard? How frequent? Like, I want to know all of it. Size, color, frequency, all of it. Because my norm, just because it's my norm, which are like rabbit pellets, and I don't feel like I've evacuated completely, that's not normal.
I think, a lot of it is, hey, we've normalized it, so it's normal to us. But when you realize, hey, it's not normal, it's your body sends you messages all the time. We just don't know how to interpret them. And if there's anything anybody takes away from today, it's start listening to your body's messages. Start noticing, hey, what do my poops look like? Like, is there emotional stress related to my physical pain? What have I been kind of pushing down and ignoring? Because I actually have found that people that over-exercise are almost emotionally suppressing. And it's like, yeah, you can exercise a lot and get that out, but you're not addressing why you have to keep doing that over and over. And on top of that, that goes with breath work, that goes with cold plunges and saunas. Like, those are great to support your nervous system, but why is it repeatedly being triggered. And that's the way I think of it is, okay, well, as I'm moving through this and my nervous system gets triggered, I use those as tools, but that's not my answer.
Right. And that's the same thing of like, if I have to go to physical therapy or chiropractic 3 times a week in order to reset or be okay, then am I really solving the problem or am I doing symptom management? And I think the normalization piece goes so far, in terms of women, especially like, menstruation. So I really started my visceral journey and my visceral research journey on the digestive system because I said this, 85% of low back pain has unknown cause, right? We call it chronic nonspecific low back pain because we say you have low back pain, we don't know why. We do know that the digestive system can refer pain to the low back, but the Western medical system is like, nah, it's not that, But so my question was, if we don't know what it is, how can we say it's not that? So that was kind of my thinking. And then over time, I sort of shifted to say, well, really, there's so little research being done on women. There's so little research being done on women who have pain during menstruation that this is really where I need to have my focus. And that's where I've kind of shifted over the last year, 2 years actually. And so, yes, you are twice as likely to have low back pain if you have IBS, but you're 2.5 times more likely to have chronic pelvic pain later in life if you have pain during menstruation. And talk about something that's been hyper normalized to the extent, it's so funny. It's like it's both ends of the wrong spectrum. It's like, yeah, you have period pain. We all do. Get over it. And also that's too taboo. Don't talk about it. Nobody wants to hear about that.
Oh, I just did a podcast on estrogen dominance and I've gotten so many messages like, who do I go to? And it's even hard to find people that treat that, and
like women are screaming for it.
They're screaming for it. And I'll tell people, I'm like, listen, look at the menstrual cycle, like pull it up. There's plenty of images online and you'll see the different waves of your cycle. And people will be tested on like day 8. I'm like, that tells you not like, that's not telling you anything. You don't see many spikes during that time versus this is why there's day 21, because that's roughly when progesterone spikes. And so you can look at it and the more you learn about it and you're like, oh, I'm having pain today. Well, what phase of my cycle am I in? Let me pull that up. Let me look at what's supposed to be happening right now. And the more data you can collect, the more you can start advocating and finding the right practitioners to help you. But even on my side, it's hard to know who to refer to for these certain conditions because estrogen dominance still isn't mainstream on treating. And I will say for people, I want to say it's the episode, for me, it's the episode 8 on my podcast where we dove a lot more into estrogen dominance. So you guys, if you're having painful periods and understanding it from that level, because that's a whole nother animal and another topic to address. And it was episode 7 of this season 2, where we dive into that. And one of the main causes of so in very briefly explaining it, it's a lot of it is the progesterone to estrogen ratio being off, where you have more estrogen than your progesterone still higher in the luteal phase, but the ratio is off. And a lot of times, you can have a variety of reasons why your progesterone is low. But one of the major causes of low progesterone is chronic stress, because your body makes cortisol and diverts to cortisol and prioritizes that over progesterone. So people are put on estrogen birth control, which I'm just floored that we're putting people on estrogen birth control, which is almost worsening the problem. Then we're not addressing the nervous system. And then we're like, why are they having all these symptoms and then they can't get pregnant? It's just, it's such a disturbance. It's such a disturbance.
Yeah. And there are subgroups of people who have pain during menstruation. Some of it is related to estrogen dominance and some of it is related to other things. So it's a really complex problem that we have not really addressed and not really looked into enough. And that was part of why I switched my focus as well, because, I was told, well, if you're going to do this IBS study, you should really do it on men because women are too hard to study. And that's in part because anytime you're studying women, your pain perception changes throughout your menstrual cycle because your hormones have a big impact on your perception of pain. And so for my study, I'm having to capture women during like mid-luteal phase, which is challenging. Like we have to get 4 researchers together in a room. We have to schedule these people that all have real full-time jobs like myself and the participant in the room within this window of time. Yes, it is more challenging. Does that mean it's not worth doing? In my opinion, absolutely not. Also, I think I'm probably just that person that like someone told me I couldn't do something. So I was like, all right, well, here I go then, like.
Well, we need people like you to do that, to help with this, because not all of it is estrogen dominance. That's one piece, but what else? What other factors? And I think it's also hard because people have been put on chronic like birth control for decades, and it's hard to measure their luteal phase too if they're on
Sure.
on birth control for that long. And so you've got so many factors. We could go on for another like 5 hours on
I know.
but yeah, I mean, there's a lot. And I would just tell people, just start tracking. Like I get people to like, just start noticing, tracking, being aware of your body signals. You don't have to do anything with it yet, but you'll be shocked on just listening and noticing your poops, noticing what are your poops like during your luteal phase. So that's usually after day 14 to 28 or whatever length of your period is before you have your period. And it's not, people are like, oh, it's not, I'm fine on my period. And I'm like, no, it's the whole cycle. It's not, because you have a fluctuation of hormones in so many different aspects. So track it, start tracking your period, start noticing your gut, your nervous system, your pain, and all of these different things. And even tracking your emotional state, like what stressors had been going on as well.
Yeah. And if you can just start to recognize some of those connections. And I always tell people, I love that new thing on Instagram, like we listen and we don't judge, right? You could do the same with your body. You're just a non-judgmental observer. You're not trying to draw conclusions about what's going on or what might be causing this. You're just sort of saying like, oh, that was interesting. That was a different, I'm just collecting data points. Like you speak to my researcher heart, my little researcher heart goes pitter pat when you talk about data points, but like it's a part of knowledge, and knowledge is power, and knowledge about our own bodies empowers us, I think, tremendously.
We're our own little research study. Like you're a research study of one, and your body is going to be different than my body. And nobody's going to know your body better than the person that's in it 24/7. And yeah, you can go, like, when you collect that data, then you can go out and kind of seek help and then ask more direct questions. Because in our healthcare system, this is vital. This is vital because if you're going to somebody in network with insurance, they probably have 5 to 10 minutes. They don't have the ability to do that. So if you can be like, hey, this is what I'm experiencing on this days, and this is what's going on, they may be able to kind of get you those answers faster because they're not going to have the time to tell you. And yeah, you can go out of network and find people that way. But in general, that's just kind of the more data points you can give your practitioner, the less that just consolidates that time.
Yeah, absolutely. Huge.
Well, thank you so much for being on here. This was such a fascinating, hearing your research side speaks to my heart. I think eventually one day I want to get into research because I'd love to just work with you. Yeah. Because we need this. We need more of us out here, explaining to people what's going on versus, dismissing and the research is just not where it should be for women. So how can people find you if you want to tell them about your Instagram and your website? And yeah.
Yeah, so my practice is in Santa Monica, California, and you can find me at megansteelept.com, and my Instagram is painscienceprof.
Cool. Well, I will tag that in the podcast notes here. So thank you so much. I think it was nice chatting with you.
Thank you so much. It was great to be here.
You've been listening to TMI Talk with your host, Dr. Mary Grimberg. Make sure to subscribe wherever you get your podcasts. To learn more about Dr. Mary, head on over to drmarygrimberg.com. And make sure to follow Dr. Mary at Dr. Mary PT on all social channels. To learn more about Dr. Mary's integrative practice for pain relief in Austin, Texas, head on over to resilient-rx.com. Thanks for listening.